the Office of Developmental Disability Services wants to support you to make a decision about returning to work based on your goals and needs. We're here to provide information and resources to help you keep yourself and your loved ones safe, and to provide education on how you can return to work safely, if that's what you choose to do. This decision will be different for every person, depending on their job and comfort level. Because of the risks that people with disabilities face due to COVID-19, the Office of Developmental Disability Services continues to encourage everyone to stay home and stay safe as much as possible. Staying home and reducing contact with others can protect you and those around you. We've heard from many people that they would like to return to work, find a new job, or even find their first job. If you want to return to work, we recommend you make a plan. You can ask your case manager or someone else you trust to help make a plan if you might be returning to work. Please consider why you want to go or return to work. Is it spending time with coworkers, even if it's via video chat? Earning a wage? Or is it having a routine? These are all reasons we've heard. What type of work might help you to meet your goals? If you miss having a routine, you may be able to find a job that allows for physical distancing, which could lower the risk of getting COVID-19. To make a plan to return to your job, start thinking about the 3 H's: hazards, hygiene, and hold back. What kinds of hazards could you face in the workplace? Think about how you may be likely to be exposed in the work that you do. Could you be exposed from customers or visitors, as well as fellow coworkers? How is your county or city doing managing the current outbreaks? Are you living or working in a county in phase 2 of reopening? What will happen with your job if your county is moved back to phase 1? What are some hygiene considerations? This includes washing or sanitizing your hands, covering coughs and sneezes when you're not wearing a face covering, and cleaning and disinfecting surfaces. Is there soap, water, and paper towels available to wash your hands frequently at work? Are these things also available for customers and visitors to help reduce the spread of germs? If soap and water are not readily available, is there hand sanitizer available to you, customers, and visitors? How often are surfaces wiped down and disinfected in shared areas? How will you help to hold back the spread? How do you plan to keep your physical distance from others? Are there other people that you work with who will also help keep 6 feet of distance between each other? Will everyone wear a mask, including visitors? Is it possible to work a shift or a schedule that limits your close contact with others? Perhaps you can explore working from home to limit your contact with others while still providing a valuable service to your employer. We'd also like you to think about transportation. How will you get to work? If you use the public bus, taxi, or other ride service to get to work, make a plan to maintain 6 feet of distance from other passengers. Please avoid high-touch surfaces like grab bars and handrails, and wash your hands or use hand sanitizer as soon as possible after leaving. If you need support for transportation, can you get a ride from someone like a family member, a friend, a coworker, employment or day support, or even your residential support staff? Consider if the benefit of returning to work outweighs any possible health risks. Talk to your team and the people you trust about your options. If you don't feel safe returning to work, consider the other options for staying active and busy. There may be volunteer activities you can do from home or skills you can work on, such as online classes or activities. Please discuss any concerns you may have with your employer and ask questions about workplace safety and health concerns. You have a right to a safe and healthy work environment. Please contact your services coordinator or personal agent if you want to make a plan to return to work safely.